a lot of those patients are getting neuromodulation or a spinal cord stimulator. People always want to ask, like, how bad is this going to be?
Right.
Hurt? Is this super painful? In terms of all the procedures that I do, it's one of the ones that I get the least complaints about being painful or uncomfortable or
it's similar to an injection.
Yeah,
That's
it's basically an epidural
Yeah.
injection.
So from the patient point of view, it's pretty simple. You're showing up, you're doing your imaging, you're doing your testing.
Yep.
You're coming in, 20-minute procedure.
Yep. A lot of times people's family will say like, hey, I've noticed like a big change.
So Dr. Sleep, I want to talk about some of the procedures that we do and some of the solutions that we offer people. So for failed back surgery syndrome, for neuropathy, walk me through what it looks like for a patient and what that experience would be like for them to come in and go through the trial and implant process. What does that look like?
Sure. So a lot of those patients are getting neuromodulation or a spinal cord stimulator. So really, patient comes in with typically some sort of neuropathy type complaint, burning, tingling, numbness in an extremity. We work that patient up. We try to determine the cause. Frequently, these patients have spine issues or are diabetic. Those are probably the two biggest.
And diabetes is huge. That's like such a growing number these days.
Yes.
With the baby boomers.
And a difficult thing to treat as well. So these patients typically have been through, Gabapentin, Lyrica, antidepressant medications, topical creams and things like that, and really have either had a side effect or not much relief. So the process for us is you'll have a consultation there in the clinic. We take x-rays. We present kind of our plan to the patient. And typically with those type of patients, we're offering some sort of spinal cord stimulation or neuromodulation. And a lot of this is insurance requirements, but we send you for a psychological evaluation. I think it's silly that the insurance companies require that, but it is what it is.
To be clear, it's ridiculous. And
Yeah.
it has nothing to do with whether or not they are a candidate, but it is a hoop that we jump
Correct.
through.
And I think that should be something that I get to determine as the physician and say, look, this person, is clearly sane from a mental standpoint. They're normal in every way, shape, or form.
Well, to our theme on Medicine Uncensored, it's a complete overstep of the insurance industry.
Sure. Yeah.
This is a decision that should be made by a doctor.
Yeah, and I think I should be able to have a say in whether or not someone needs that. But anyway,
course.
it is what it is. It has to get done. Then we'll typically order some sort of advanced imaging of the area, typically an MRI or a CT scan. And we're making sure that there's no gross abnormalities there that would prevent us from doing the procedure, maybe even make it dangerous for you. That's very much a safety kind of thing. And every now and then we find something unusual on there. We have to say, look, you probably need to go see a neurosurgeon about a syrinx or, a cyst or something unusual there. And we have some good relationships with surgeons that we can send people to for those consultations.
And I think normally on the guys that we send to go get MRI, because it's often now, it's become a requirement for almost for a lot of our procedures, even epidurals at this point, which again, it is what it is and is an insurance thing. But I think some people have, and this goes back to, probably 5-10 years ago, people were very worried about getting advanced imaging if they had a heart condition like a pacemaker or whatever. And I believe nowadays they're still able to get, in most cases, an MRI or a CT or something.
Yeah, so depends on how old the pacemaker is. Certainly there are some newer ones that are MRI compatible, but most of the older ones are not. And so if that's the case, we have to get a CT scan or a myelogram sometimes. Or
but the door's still open. There's still a solution.
Exactly, and there's ways to overcome those hurdles. I won't say that it's an absolute necessity for everyone, but it is something that we try to do for a majority of our patients. And it's just a safety kind of check there to make sure that there's nothing there that's going to prevent us from having a successful trial.
Right.
And then we get lab work. We want to make sure that from a whole body physiologic standpoint that there's nothing outstanding there that would concern us. If you're diabetic, we're checking your A1C values, seeing what your blood sugar control has been over the last couple of months. And then once we get all this information, we send it to the insurance company to get their approval. That can be anywhere from a couple of days to a couple of weeks.
Yep.
And the patient is then notified of the date of their trial. The trial is really the crux of the spinal cord stimulator. And during this process, it's all done through a needle. There's no incisions. You're given a little bit of, we'll say, relaxing medicine to help you tolerate the procedure. The procedure really only lasts about 15 or 20 minutes in most cases. We do use an X-ray camera, and it's done here at our surgery center, so there's some safety built into that as well. But we numb up the area on your back around T12L1 area, depending on what your spine looks like, and hardware and other things there. Then we advance a needle into the epidural space, and then again, that just takes a couple of minutes. When the needle's in the right spot, we'll then advance the lead or the wire into the epidural space. We'll typically place 2 wires to typically kind of cover both sides of the back or legs or feet. Once those are in, we'll take the needles out, leaving the wires in place, and we tape everything down on the patient's back. In terms of, people always want to ask, like, how bad is this going to be hurt? Is this super painful? Really, in terms of all the procedures that I do, it's one of the ones that I get the least complaints about being painful or uncomfortable or
it's similar to an injection.
Yeah, it's basically an epidural injection. And so it's generally very well tolerated. After that, 20 minutes or so of putting that in, we keep the patient in our holding area, which is this room that we're in right now, and a representative from the device company will be there. They will turn on the system and they'll do some mapping. And that is that they turn up a little bit of stimulation there in a way that the patient can feel it. And we're making sure that the patient feels that stimulation in the areas where they have pain.
So it's a check to make sure it's working.
It's a check to make sure that we're in the right spot. And sometimes people have really bad like scoliosis or kyphosis. It doesn't mean that this procedure can't be done, but what it means is what we see as anatomical midline may not necessarily be actual midline for the patient. And so that can help check that as well. They'll teach the patient how to use the device. There's typically a little remote control, and it's pretty basic. There's an up and a down button and an off and an on, and maybe another button where they can cycle through some different programs, but it's all pretty basic. Then we send the patient home. They get to keep the device for a week and try it for themselves. And I really think that that's the key to all of this is, during the trial, are you able to get good relief, and are you able to be more functional? Are you able to sleep better? Are you in a better mood? A lot of times people's families will say like, hey, I've noticed like a big change during this week. The goalpost is 50% improvement. Certainly, majority of our patients that do the trial report more than that.
And so just to clarify, so I just want to summarize, because we went over a lot of detail there that I think most people have not heard before.
Yeah.
So patient comes in, they're getting an exam, they're getting consultation, they're getting exam, there's some imaging, some other imaging is ordered and then done, some other testing, blood tests, psych tests, etc. And this whole cycle takes place. So from the patient point of view, it's pretty simple. You're showing up, you're doing your imaging, you're doing your testing.
Yep.
You're coming in, 20-minute procedure.
Yep.
They're recovering. Are they able to drive home same day? Are they able to walk out on their own? Is there recovery?
Usually they're walking out on their own. Because we do give a little bit of like sedation medicine, we tell them not to drive for the rest of the day.
Yeah.
And that's a safety thing. We don't want anyone getting in a car accident or getting hurt. But then typically it takes the stimulation a day or two to kind of build up in the system. Sure. And then your back can be sore it shouldn't be anything that's terrible, but a little bit of soreness there is not uncommon for a day or two after the procedure. And then usually by the second or third day of the procedure, patients are getting a lot of relief. They're doing a lot of their normal activities.
Yeah.
They're kind of testing it out. I want to go to the grocery store. Can this help me when I'm trying to cook or clean or do some activities at home?
And the patient's going to tell you whether or not the thing worked. At the end of the day, the patient's going to say, okay, this worked for me and I feel at least 50% better, or it didn't work for me and I don't feel 50% better.
Correct.
So let's say the patient, it did work for them. They got at least a 50% improvement, which is a huge improvement for most people.
Correct.
If that happens, walk me through what happens next.
Yeah, so you'll come into the office for a lead pull, okay? The wires come right out. It's not a painful thing at all. Usually we take the tape off, the wires pull out.
Right.
It's like pulling the tape off is more painful or more uncomfortable. Patient tells us they want to proceed. We get them on the schedule for the surgery, for the permanent implant, the permanent version. Usually that's done within a month, I would say, for most patients. Again, that's a small surgery that we do here. It takes us about an hour. For that procedure, there's 2 incisions, okay? And this is basically so we can just hide everything underneath your skin.
Yep.
The first incision is in kind of the middle part of your low back, okay? Once we make that incision, it's typically no more than an inch or so deep, and we're not going into the bones, we're not going into the muscle, we're not going through anything there. We then put the needles and wires in just like we did for the trial, okay? We take the needles out, leaving the wires in place. We put it like a sleeve around that wire so that we can anchor it down to the strong tissue there to prevent those wires from moving or migrating. Then we'll make the battery pocket. People usually, I find that it's the most comfortable position is on the side. We let people choose which side, and we kind of tailor that to each individual patient where that would be most comfortable for them. We certainly don't want that over your belt line, over your waistline.
Sure. But just so everybody knows, if you haven't seen one of these batteries before, generally we're talking about something the size of about an Oreo.
I tell people, yeah, a double stuffed Oreo cookie is about right.
So it's not a huge thing.
Very small.
We're still in the zone of minimally invasive here.
Absolutely, absolutely.
Yeah.
Tunnel the wires underneath the skin to the small battery, connect it, turn it on, make sure that everything's functioning appropriately, and then close up. It takes about an hour. The recovery from that is pretty minimal. I would say that I write usually a couple of days of pain medicines for people. They usually don't require any more. The biggest complaint, if there is one, is just it's really sore back there, and pain medicines don't really help great with that anyway. We do have people on light restrictions for about 6 to 8 weeks. We want to give your body time to heal and for scar tissue to form around the wires.
So that they don't pull.
Yeah.
Makes
sense. And then, you know, back to normal life after that for the most part. Not a whole lot of restrictions. People ask about, you know, is this going to keep me from doing all these things? So no, really the idea is for this to help you so you can get back to doing those things and not be dependent and reliant on taking a pill every day or coming into a doctor's office every month and doing a drug test and things like that. And I will say, you know, I get very few complaints. Most of our patients with our stimulators are very, very, very happy. It's been a very rewarding opportunity, a very rewarding therapy to offer patients who have struggled with these problems for years and have not had good solutions.